Member from Kenora-Rainy River.
Thank you, Speaker. My question is to the Premier. Last week, Nishnawnaga First Nation declared a state of emergency, looking for provincial assistance with a suicide crisis that has rocked the community. The community attributed these suicides to the social conditions in the community, including prescription drug abuse, poor water quality, inadequate policing, and lack of access to mental health and addictions workers. Issues that the province has been aware of for years. My question is simple. Does the Premier believe First Nations need to declare states of emergency to access the basic health services that they need?
Thank you very much, Mr. Speaker. And of course, I do not believe that First Nations communities need to declare states of emergency in order to get services. And Mr. Speaker, I had the opportunity to speak with Chief Munias at the time that the emergency was declared to make sure that Emergency Management Ontario was aware, Mr. Speaker, to make sure that everything that we could do, that we would do to deal with the particular circumstances. I know that the Minister of Aboriginal Affairs has also had a chance to speak with the Chief. And Mr. Speaker, we will need to work with our partners, as is always the case in these situations, because the federal government and the provincial government and First Nations communities always have to work in partnership, because these are shared responsibilities, Mr. Speaker. So we are very much a part of that, and we are doing everything that we can.
Thank you. Supplementary.
Nishnawnaga is not the first community to declare a state of emergency. It is only the latest. In 2009, it took pressure of the NDP to get the Ontario government to commit funding for a Pegatano First Nations suicide prevention program. Yet, last year, the same government cancelled $1.7 million of that funding, leaving the community without support. Each and every community across the far north is dealing with similar challenges, and as the former Minister of Aboriginal Affairs, the Premier knows this well. Will the Premier commit today to address the social conditions existing on all First Nation communities, or does every community need to declare a state of emergency to get basic help from your government?
Mr. Speaker, I am so committed to improving the lot of the people who live in First Nations communities. And Mr. Speaker, you know, these are complex issues that are rooted in a history, Mr. Speaker, of which all of us have to share some shame and blame, Mr. Speaker, because we have not, as a society, provincial government, it doesn't matter what party, it doesn't matter what level of government, we have not always worked in the best interest of the people who we share this province with, Mr. Speaker. And so whether it's First Nations education, or whether it's First Nations healthcare, Mr. Speaker, or whether it's the infrastructure on reserves, I am committed to working with my colleagues, to working with the federal government, Mr. Speaker, to working with the First Nations communities to make sure that we address these complex issues. We have done more, Mr. Speaker, to build those relationships and make sure that services flow to First Nations in the last 15 years, Mr. Speaker, and we will continue to do that work.